Hi, my name is Chris, and during this video I'll be demonstrating venous access and the administration of a radioactive tracer for the use in nuclear medicine imaging using a butterfly needle and a three-way stopcock. So with that said, I have some of the supplies that we'll need laid out here. The first thing that we're going to need is the radiopharmaceutical dose. This is what we're going to inject into the patient, and it's what allows us to take pictures with our camera. And the dose is generally ordered ahead of time from the radiopharmacy. The dose itself needs to be shielded to reduce radiation exposure. What we have on the actual syringe is what we call a lead syringe shield. And the syringe just slides right into the lead syringe shield, and we can tighten it so it stays nice and secure while we're actually injecting it. And we also have a secondary shielding here, and this is called a lead pig. We also have the order. The order is what we use to identify the patient and to confirm that the proper indication for the study being performed is correct and that we're actually doing the proper study. I also have some of the other supplies that we'll need for the actual injection, and that's pretty much what the rest of the stuff is. So what everything's laying on here is called the chucks. That's basically, it's just an absorbent pad that is going to catch anything from the injection. It helps reduce spread of any kind of pathogens or any radiation contamination. The gloves are going to do basically the same thing. They protect the patient, but they're also going to be your personal protection against any kind of bloodborne pathogens or any radiation contamination. The tourniquet here is what we'll place on the patient right above the injection site to help put pressure on the veins, and that's going to help them kind of pop out a little bit better so that we can find a good vein while we're shopping and get a good injection. The alcohol prep pads here, these are what we're going to use to wipe the area that we choose to inject and help prepare it and sterilize it for the injection before we poke it with the needle. And the needle itself we use for this, what we're using is what we call a butterfly. It's called a butterfly because it has these two little wings on it that we'll see later. And it's really nice, small little needle. You can just poke it in there. It doesn't stay in like an IV catheter, and then it comes out right after the injection. That's going to attach to this guy, which I have one open here. This is what they call a three-way stopcock because it has three different connections here. And one is going to be for the butterfly going into the patient. We're going to put the dose here and put the saline on the other side. And what that's going to allow us to do is use the saline to make sure that the IV is actually, or the butterfly is actually working and that it's flowing. And then when we inject the dose, it's going to allow us to inject the dose and then flush the dose with saline and make sure that we get it all into the patient. That's going to help get the full dose into the patient, as well as it's going to reduce radiation contamination afterwards because there's going to be a lot less left in the actual syringe. And then the saline that I just mentioned is what we're going to use to flush the line before and after the injection. The tape we're going to use here, just one little piece of tape I had already cut ahead of time because it's a lot easier than trying to pull it off of the roll as you're doing the whole procedure. That we're going to use to tape down the butterfly and keep it nice and secure during the injection. After we're done with the injection, we have gauze. Once we pull that butterfly out of the patient, that's going to help cover the injection site, and if there's any blood coming out, it's going to help to contain that. And then the Coban will just wrap around that and keep that all contained. The last thing that we have is this little guy, which is called a NERD, which is short for needle recapping device. And what that allows us to do is when we're putting the dose onto the three-way stopcock, we're going to take that needle off so we can screw the syringe onto the stopcock. And what this lets us do is just put the syringe needle there, so when it's time to recap, we can just screw it right back on and put it back in our pig, and nothing's turned upside down, so it's going to reduce the likelihood of contamination of the tracer. It's going to also help anytime we're actually using the needle on an exposed needle. It's going to help reduce the likelihood of unwanted accidental needle sticks. Okay, so now that we've gone over some of the supplies that we'll be using, we can actually start using some. So what we're going to do with this stuff here is, before the patient gets here, just get the three-way stopcock butterfly assembly put together. And what you're always going to do first, which I've already done, is wash my hands, and then you're going to put on gloves just to keep everything sterile. We've also put down the chucks to get to keep the whole area nice and clean underneath what we're going to be doing too. You don't want to just be doing this on any countertop. And I've got 2 of everything, just because more often than not something's going to malfunction and you don't have the second one close by, and it's a really inconvenient. So just to have 2 of everything, it's better to have it and not need it than need it and then not have it near. So what I've got is the butterfly, and I'm going to open that up. So the butterfly needle actually has a cap on it, and then the end here is capped. So what you don't want to do is be handling the ends of where any of the attachments are, because you want to keep everything as sterile as possible. So I just like to take everything out, get it all ready before I start opening anything up. And one of the first things that we're going to want to do with the saline is to pull back on it to kind of break that seal, and then push it up until some comes out of the top. And now it's primed, there's no more air, and it's okay to use and start to push through the line. The next thing we have to do is just assemble everything here. So this side accepts the butterfly, and you just push it on there, and then that comes over, covers it, and screws on. And the dose is going to go onto this one, but we're not going to do that yet because the patient's not here. We haven't assayed the dose. We don't want to increase any kind of radiation exposure. We want to wait till the last possible minute to get that involved. So now we have our saline attached. We have our stopcock connecting that to the butterfly, and we have our lever pointed towards where our dose will be. Wherever that's pointed, that's what's going to be shut off. So now this line is open from the saline to the butterfly, and what we want to do is get all the air out of the stopcock and the butterfly, so we can just push it until we see some water come out at the top there. So now there's no air bubbles, and it's ready to inject. Okay, now that we have our three-way stopcock butterfly assembly put together, we're ready to start getting some of the other supplies prepared for the actual injection. So the patient's arrived, and we have just assayed the dose, making sure to do it as close to the time of injection as possible, just to make sure the amount of activity that's measured when we assay it is what we're actually injecting into the patient. We've shielded it, we've also put it in the lead pig, and we have checked the label on the syringe to make sure that it's the right dose for the right patient, and it's for the right date and time. And we have got all of our other supplies that I've covered before ready for the injection. The other thing that we're going to do is, again, check the order. It's always double check everything, make sure everything matches. So the dose is for this patient, the orders for this patient, the indication is appropriate for the study that we're doing for this specific patient, and everything matches. So it's double, triple, quadruple check and make sure everything is on track before we actually inject this dose into the patient. For the video's sake, we're just going to simulate some of these things because we still have to get to the injection. So we're just going to say the patient's here. We always identify the patient by asking them their name and their date of birth, and we double check their ID bracelet. We make sure all of that matches the order, and that the syringe and everything is all in line and matches. We're going to explain the procedure of what we're going to be doing as far as the injection to the patient, take an appropriate history for the specific study, and of course ask females if they are pregnant or nursing. Okay, so the patient's here and we're ready to start the injection. So the first thing I'm going to do is look at both of the arms and see what looks like a good injection site, if there's any veins that are visible, and I'll palpate them to see how they feel. The best thing to do now is to get the tourniquet on and see how they're gonna pop out. That'll really help get a better vein for the injection. So you can see this one here is already really nice and fat and popping out. So I think that's the one I'll go with. So what I'm going to do first is prepare it just by cleaning it off with an alcohol pad. And what I don't want to do is touch it after I've wiped it, because that's not going to keep it clean. So really scrub it there. And then I like to do this trick, which is just to put the tip of the alcohol pad pointed at where I want the injection site to be, so that when I go over here to look away from the injection site, I can still remember where it is. So I'm going to get my butterfly needle and take the cap off, pull the guard back, hold it by the wings, keep the bevel up, and then I'm going to access the vein. And I'm just going to give it a little poke, and 3, 2, 1. Okay, looking for flashback in the needle, which I see, and I'm going to pull back to make sure that it's nice and flowing. Looks like it is, yep. And now I'm going to push a little bit of saline and look to make sure that it's not infiltrating and it's not bubbling up. And I'll ask the patient if they feel any burning, and if not, then it looks like we're good to inject. So now I'm going to secure that butterfly and keep it secure for the injection. That piece of tape that I already had cut. Remove the tourniquet, and now I can finally get my dose and screw it on to the 3-way stopcock. And I'm just going to use the nerd over here so it's easier to recap, and I don't have that cap just floating around contaminating everything. Okay, so I've got the dose attached now. This is simply saline, so I'm not actually using a radioactive tracer at this point. And keep watching the injection site, make sure there's no infiltration. Looks good. The injection for the tracer is done. Now we're just going to flush that out with the saline. So as I push this saline in, it's going to fill up the dose syringe, and then I'm going to flip that switch back to the saline and flush everything in the dose syringe into the patient so we get a nice study. Takes a little while because this is a 10 cc saline syringe and it's only a 3 cc syringe that contained the dose. But now everything's flushed and the injection part is complete. Now I can just take that piece of tape off, just put it on loosely so it's a little bit easier to take off at the end, and then put gauze over the site. Pull that needle back, and then we're going to want to pull back on the butterfly to get any potential blood or radiation back into the butterfly, and then snap the safety device over the needle, and then we're going to just put Coban over the injection site. And the injection now is complete. Now that the patient is injected, we just have to clean everything up. So the most important thing to keep in mind is safety, whether it's relating to radiation contamination, radiation exposure, or bloodborne pathogens. So the first thing we could do is we want to get rid of any kind of potential radiation exposure. So anything that had the dose attached to it or it ran through, we want to get rid of that first. So we can unscrew our dose, and then we've got our nerd over here, which we can reattach the needle with. Put that right into the pig, and now that's ready to go back into the hot lab, and we can take the syringe out of the lead shielding, put that in right into the hot sharps, and put everything else back to be used again. And we are going to just take this entire assembly, because this had radiation dose running through it. We want to get that into the hot sharps too. Even though it was flush, there's more than likely there's still residual amount of radiation in there. So we're going to say all this stuff is gone now. It's in the hot sharps. This is going to go back into the hot lab again, and we've got all of our other supplies. We're just going to take our tourniquet, and we can just wipe it down with our alcohol pad, and we can reuse that again. And then everything else, if you really wanted to, you could survey it with a survey meter to make sure that it's not hot, but there could be some contamination on the tape, there could be some on the alcohol, there could be a drip or two on the chucks. So you can survey it, and if it's cold, just put it right into the cold trash. But I'll usually just fold everything up and do something like that before I survey it, and then determine where it's going to go. More than likely it's going to go in the hot trash, because you're probably going to get some amount of reading off of it. And so pretty much everything's done. The last thing we've got to do is just survey the area where we did the injection, which we could just do with a Geiger counter survey meter. Make sure that there isn't any residual contamination from the dose, and if there is, we would take the proper steps and do a proper spill cleanup and wipe test to make sure that there's nothing left before we actually leave it unattended.